Hello, this is Doug Shadel, State Director for AARP Washington, and I want to welcome you to this important discussion about the coronavirus. Today, we are fortunate to have some very special guests with us to discuss this issue. In a few minutes, we will be speaking with Washington Governor Jay Inslee, whose office has been proactively addressing this outbreak since it first began. We are also fortunate to have Secretary John Wiesman with the Washington State Department of Health here to participate in the call. We will be discussing the latest developments in the fight against the coronavirus pandemic, what our state and local communities are doing to combat it, and answer any questions you might have. And a little later, we will be joined by Washington State Attorney General Bob Ferguson, who will give us an update about how the scammers are using this horrible disease to scam people out of their hard-earned money. AARP Washington is a nonprofit, nonpartisan social impact organization with over 940,000 members in Washington state. We've been working to promote the health and well-being of older Americans for more than 60 years. In the face of this crisis, AARP is providing information and resources to help older people and those caring for them protect themselves from the virus and prevent its spread to others. According to the Centers for Disease Control and Prevention, the CDC, older adults and people with underlying health conditions like heart disease, lung disease, and diabetes are about twice as likely to develop serious outcomes as younger, healthier people. This is your opportunity to learn, to ask questions, and to get answers from your public officials. If you've participated in one of our TeleTown halls before, you know this is similar to a radio talk show, and you have the opportunity to ask questions live of our guests. If you would like to ask a question about the coronavirus, press *3 on your telephone keypad now to be connected with an AARP staff member who will note your name and question and place you in a queue to ask that question live. Again, to ask your question, all you have to do is press *3 now. If you're just joining us, my name is Doug Shadel, State Director for AARP Washington, and I want to welcome you to this important discussion about coronavirus with special guest Governor Jay Inslee and Secretary John Wiesman with the Washington State Department of Health. Later, we will be joined by another special guest, Washington Attorney General Bob Ferguson, who will describe some of the scams that are going on that are tied to the coronavirus outbreak. In today's discussion, we will focus on factual health information in order to ensure you are up to date and informed to keep you and your family healthy and safe. As we proceed, I will be mentioning a couple of websites you can turn to with a lot of great up-to-date information about the coronavirus. One is our website, and that address is www.aarp.org/coronavirus. AARP is convening this TeleTown hall to supply information about the coronavirus, also referred to as COVID-19, in an effort to help protect the public. While we see an important role for AARP to play in providing consumer information and advocacy related to the virus, the public should be aware that one of the best sources of health and medical information is the Centers for Disease Control and Prevention, the CDC, and it can be reached at www.cdc.gov/coronavirus. And I'm going to give you one more website, and if you haven't written all of these down, rest assured that we will give you a website at the very end of the call today where you can get all of these, where all of these will be posted. But another important resource you may hear us talking about today is the Elder Care Locator. And this is a site that will connect you to local area agencies on aging who can help provide you with information about senior services that are available in your local community. And you can reach them at 1-800-677-1116, 1-800-677-1116. And again, if you missed writing any of these down, we will have them all available on our website, and I'll give you that address at the end of the call. Well, we're fortunate today to have with us two state government officials who are able to provide current information on this topic. First, I'd like to introduce Washington Governor Jay Inslee, who has found himself, along with us, at the epicenter of this pandemic in the United States. I'd like to thank Governor Inslee for his leadership in fighting this outbreak. And Governor Inslee, you have been with us for many, many TeleTown halls over the years, but this one feels different. It feels more urgent. I'd like you to invite you to make some opening comments. Governor?
Yes, thank you for an opportunity to talk to the most important people in the state of Washington, and that is the AARP members in the state of Washington. And I say that with no exaggeration at all, and I'll tell you why that is really the truth for a couple different reasons. And I want to thank AARP. I want to thank Walt Bowen for his leadership and everybody on this call. Here's a couple reasons why the people on this call and the generation and generations that they represent are the most important. One is from an inspirational standpoint. This is a moment of great anxiety in our state that's understandable and real. It's a time of a lot of uncertainty. But this is a generation that I think is epitomized, or generations, by my old basketball coach, Walt Milroy. He was my coach in 1969 when I was playing on a high school team, and I talked to him the other day about this. He's now in good health and really sharp. And he was sounded very philosophical when I was talking to him. He's doing the right thing to take care of himself and avoiding other people right now. He said, Jay, I've lived through the Great Depression. I lived through World War II. I've lived through the Vietnam and Korean Wars. I've seen so much in my life that over the decades has frequently been challenging. But he said, we have always come through. And that's a real inspirational thing. And the people on this call, I think, have an understanding of that. There is an advantage of having years under your belt, and that's is you understand that how we can come through tough times. So that's one reason folks on this call are so important to our state right now, is to be leaders, to give people confidence that we are going to get through this together. So that's one reason. But there's a second reason that is more important, and that's the main reason I wanted to talk with you today. And that is that the single best way we can come through this with a minimal number of lost loved ones is for people on this phone call, and people of similar age can essentially wrap themselves in a bubble right now. Here's the reason why. The people who are really at risk in our state today are AARP members. Just a couple of statistics to think about. We know that as we age, we become much more susceptible to fatalities from COVID-19. For instance, in our state, 93% of all the fatalities we've had have been on people over the age of 60, 93%. And that number is fairly consistent with the worldwide averages. So the vast, vast majority of our fatalities, if we don't get this under control, would be in AARP members. A couple other statistics. At age 60 to 69, that represents 10% of the deaths. At age 70 to 79, that represents 23% of the deaths, and from 80 to 89 represents 60% of the deaths. So there is a dramatic increase in our exposure to fatalities starting at about age 60 and very rapidly going up. So the people who are most at risk in our state right now are folks who are on this call, and therefore our ability to reduce fatalities is most in the hands of the people on this call and people represented in their age group. So the one thing I've said, and I really do believe this, that everybody can be a leader here, whether you're a governor or a senator or a 74-year-old grandparent. All of us have a leadership capability. And if people of AARP make individual decisions in their family life, we're going to come through this minimizing the loss of life. And that's actually the main reason I wanted a chance to talk with you today. So what does that mean? How do you be a leader if you're over 60 or over 65? Pick a number. And it's really kind of simple. This is not rocket science. It's something that is available to all of us, which is the one weapon we have against this virus. And we only have one weapon against it. The good news, it's really, really effective. And that is social distancing and avoiding interactions with other people. And I mean any other people. So what we all can do to protect ourselves and our loved ones are to absolutely minimize our physical connection with anyone outside our immediate household. And that means everyone, because everyone can be a transmitter of this virus. And every single time an AARP member comes within 6 feet of anyone outside their household, that is endangering themselves. So we clearly need to have physical distancing from everyone else in the state of Washington outside of our immediate household. And I say household, not immediate family, because there's a difference there. So here's the goal I would ask everyone on this call to embrace, and that is to make a decision in your own life to minimize physical connections, but maximize emotional connections. And I'll come back to the emotional component of this in a minute. And if I can just use a typical 69-year-old, and that's what I am, the kind of things that we are trying to minimize. I'll just give you some examples on how we've changed our life, Trudy and I. I haven't been close to my grandchildren. I have 4 grandchildren, and I have not been physically close to them for 2 or 3 weeks now, because that is just too dangerous right now for me to get on the floor and wrestle with them, or even to be within 6 feet of them inside or outside is just too dangerous. It's too dangerous to Trudy and myself, and it's in some sense dangerous to them, because if we become transmitters, we present a risk to them. So the only time I have seen them is on a walk. I saw them briefly at about 20 yards distance, where we could make sure that they were not at risk and we were not at risk. We are not going to dinners now. So obviously we all enjoy perhaps a nice glass of root beer with our friends, but we just are not doing that right now, particularly when we are inside, because we just can't be confident that we can maintain a 6-foot really social distancing that is really necessary. Our shopping now is de minimis. We're getting food when necessary, but less frequently, so that we're not exposed to shopping. I have to maintain some public presence in my particular job, but I am urging everyone, particularly those of age 65 or older, to not go to work unless you are in some just absolutely essential position that the community will collapse if you're not in it. So there's 9,400 people on our call right now, and that means we have 9,400 leaders who can really help preserve not only your lives, but to spread the message amongst your friends and relatives to be a leader in this effort. I want to address the issue of employment for the moment. We are pursuing a measure so that if you are over 65 or older, we want to get legal protection that you will, if you have to leave your job, if you want to protect yourself, and I'm suggesting you do that you will be entitled to unemployment compensation, and also prevent an employer from discharging you so that you can come back once this wave has passed us. So I am strongly encouraging people of 65 age or older not to go to work. If you can work from home, that's tremendous. But if you cannot, you really should not be going in the exposure situation right now. again, unless something is so essential to a community purpose, emergency workers, healthcare workers, and the like. So I want to make that strong suggestion. I have not issued a legally binding order in this regard. I've preferred to make an attempt to encourage Washingtonians to volunteer for this effort. And we've had some, but we haven't not had enough. And again, when I've looked at the multiple strategies we are pursuing, this is the single most effective technique, because although you can die from this virus at a younger age, the statistics are that you are just so much more endangered when you are age 60, and then the risk increases dramatically for each decade of life thereafter. So I'm just hoping that you will not only engage in these ideas yourself, but that you can share this observation with your friends electronically. And that's really important. It's kind of my third point, and that is that we want to minimize physical connections, but we want to maximize emotional connections. And that means that we should stay in touch. We should show ways to connect electronically. I just got off a FaceTime call with my grandkids, and they're cuter than heck, of course. And we got to help each other in that regard. Very quick rundown of what we're doing. We're building our surge capacity in our hospitals. We are building our masks and personal protection devices. We've got several million that are coming this weekend. And good things are happening in that regard. But you are the most important people. So I will end up there and look forward to questions.
Well, thank you very much, Governor Inslee. I really appreciate that rundown of what you're doing and your personal tips for how to stay safe, especially among our AARP population. If you're just joining us, you're listening to an AARP TeleTown Hall, and you've just been listening to Governor Jay Inslee talking about the fight against the coronavirus pandemic. My name is Doug Shadel, State Director for AARP Washington. And if you would like to join the conversation or ask the governor a question, press *3 on your telephone keypad now, and you will be connected to one of our staff people who can put you in the queue to ask a question. And if you've already done that, hang tight. We're about to get to start asking questions. There are a ton of people in the queue to ask questions of you, Governor, already. And we'll get to that in just a minute. But before we do that, I would like to introduce another senior state government official, Secretary John Wiesman, who leads the Washington State Department of Health and has been an important policy voice during this difficult time as he leads that department. Secretary Wiesman, would you like to make some opening comments?
I would. Thank you, Doug, and to all the AARP members who are joining us on this TeleTown Hall. So good morning, everyone. I really do appreciate you taking your time to be with us today to talk about keeping yourself healthy and safe at this time. I know many of you are concerned about coronavirus. The governor and I are concerned too, and we want all of us to put our good concern to good use. Because even though we don't have medication to treat this virus and we don't have a vaccine to prevent it, as the governor said, we can use good hygiene and keep physical distance from others to keep us safe and healthy. This virus is primarily spread through droplets, like the small droplets that come out of someone's mouth when they cough or sneeze. Generally, we say that being within 6 feet of someone is that danger zone from those droplets. We can become infected by those droplets when they land on our face or when we touch the surfaces where those droplets land and then touch our face without washing our hands. Knowing that this is how the virus is transmitted gives us the power to protect ourselves and those around us. So knowing this, prevention comes down to two things. As the governor said, keeping physical distance from others and good hygiene. So first of all, we really encourage folks to stay home and away from others and out of the immediate household. Wash hands often with soap and water for at least 20 seconds. And if soap and water aren't available, you can use an alcohol-based hand sanitizer that contains at least 60% alcohol. Don't touch your eyes, nose, or mouth with unwashed hands. So if you do get the virus on your hand, you don't put it into your body. And remember to always wash your hands before cooking, eating, or rubbing your eyes. Cover your cough and nose with a tissue for our coughs and sneezes, and then immediately throw it in the trash and wash your hands. And if a tissue isn't handy, cough or sneeze into your upper arm or elbow. Stay away from people who are sick and stay home if you are not feeling well, for sure. Don't share items that could spread the virus, such as utensils, cups, water, bottles, toothbrushes, or if you happen to be a cigarette smoker or vapor, don't share those either. Disinfect frequently touched surfaces such as doorknobs, faucet handles, phones, keyboards, and countertops. And again, probably especially for all of us who are on this phone and of the older population, stay home and stay away from others as much as you possibly can. Now, because persons who are 65 years of age or older, or persons who have underlying health conditions like asthma, diabetes, heart disease, or lung disease are at increased risk for severe illness from this virus if they become infected, there are some additional really, really important steps that the governor and I, as you have heard, are asking you to take. First of all, don't have visitors or other family members to your home. Don't have people over for a meal or coffee or playing games or socializing. Don't have other family over to your place, and don't go to their place. It is just too risky to do at this point in time. Even if people don't seem sick with this virus, they can have the virus and still pass it on. If you must go out in public, such as visiting the grocery store or the doctor's office, try to keep your distance at least 6 feet from others. Use hand sanitizer after you leave the store. And better yet, ask a family member or a neighbor if they can do your errands or shopping for you. Or if you can, order your groceries and other supplies you need to be delivered to your home. Now is also the time to work with your doctor to order your prescriptions in advance so that you don't run out while you're staying home. And if you can have your medications mailed to your home, that's even better. If you're still working outside the home, as the governor talked about, see if you can work from home and really give consideration to not working. If you can't do that, then do what I do when I get home. Immediately wash your hands very well with soap and water so that if you have virus on your hands, you won't bring it into your home. Then and only then greet the folks who might be in your immediate household. We also know that many of you might provide childcare and other support to extended families. If that's the case for you and these people have other options for care, they really should use those other options now. If that isn't possible, then everyone in your life really should be following the good hygiene that we've talked about. I get a lot of questions about coronavirus symptoms and who should be tested, so I want to quickly cover both topics. Typical symptoms of COVID-19, the disease caused by coronavirus, include fever, cough, shortness of breath, and symptoms could also include headache and a general sense of feeling unwell. If you have one or more of these symptoms, start by calling your doctor to discuss whether or not you should be tested and the best way to manage your symptoms. Do not visit a healthcare facility unless it's an emergency or you've been instructed to do so. If you have difficulty breathing, persistent chest pain or pressure, confusion, blueness in your face or lips, these could indicate something more serious, and then you should call 911 right away. Now, more than ever, it's important to get your information about this virus from trusted sources. I recommend the new website mentioned by the governor, coronavirus.wa.gov, as well as the CDC website at cdc.gov, and the Department of Health website at doh.wa.gov. And if you'd rather talk to a person than log on to a computer, you can call the National Call Center at 800-677-1116, or you can also call 211 to get answers to your questions. While we ask you to keep your physical distance from others, we want you to stay active and remain emotionally connected to the others, as the governor said. You can do that by getting some fresh air and some sunshine, take a walk, or work in your yard perhaps. But if you do that, stay 6 feet away from others. Don't shake people's hands, don't greet your friends with a hug, and only have a brief conversation with someone else staying at least 6 feet away. While I want you to stay informed, I encourage you to take a break from too much news or TV about coronavirus. While you're at home, listen to more music, sing, dance, read, work on your hobby, call your friends and family, do crossword puzzles, or something else that brings you joy. I recognize that what we're asking you to do is incredibly disruptive to your daily lives, but together we can all do our part to protect our health and that of the loved ones and our community. And as the governor said, doing this, we will all get this through together, and we really need your leadership and engagement. Thank you.
Thank you very much, Secretary Wiesman. If you're just joining us, you're listening to an AARP TeleTown Hall on the coronavirus, and you've just been listening to Secretary John Wiesman, who leads the Washington State Department of Health. We also have Governor Jay Inslee on the line, and in a few minutes we will also have the Attorney General Bob Ferguson coming on to talk about scams related to the coronavirus. If you all have a question for any of these three government officials, you can press *3 on your telephone keypad now, and you will be connected to one of our staff people who will put you in the queue to ask a question. And, this is our second TeleTown Hall on the coronavirus. We did one in the Seattle area last week. This is the first statewide TeleTown Hall we've done, and we now have over 13,000 people on the call. And I know people on the phone and around the country have a lot of basic questions. Our guests have already addressed some of those questions, but the thing we keep hearing about is, what is the coronavirus? How is it spread? How do you avoid it? And what are state and local agencies doing to keep us safe? And the governor and the secretary have addressed most of these questions already, but because repetition is the mother of learning, we probably will cover some of these again as we start to take questions. And we hope by the end of this call that we will have answered many of these basic questions for our AARP members on the phone. Now let's get to the phones, because we have, I can't believe how many people waiting to ask the governor and the secretary some questions. Let's start with Linda. Go ahead. Linda, are you on the line?
Yes. You have already pretty much addressed. My concern was providing childcare for young children. Physical distancing is not even going to happen when you have a 6-month-old and a 5-year-old. And providing childcare in King County, I'm in Bellingham, so I would have to go to their house. So I'm mostly asking, Doctor, at this point you're recommending against that. Is that correct?
That's right. If there are any other possibilities for child care, we're really recommending that our folks, our older folks, or those with underlying health conditions really don't provide child care. Again, children, while they don't seem to suffer as many sort of side effects or illness from this virus, we do believe that they can have it and that they can transmit it. So to keep yourself safe, that's the absolute safest thing you can do, is not provide child care right now.
Okay, thank you very much. Let's go to Vicki in Puyallup. Vicki, you have a question for the governor or the secretary?
I do. I'm a member of a church that has a couple of families that are being evicted through no fault of their own. The process will put them out of a living home into the streets in a matter of a couple of weeks or less. So my question is, because their health issues are so that they would not survive, they are elderly and they have severe health concerns. One of them is so bad he's on constant oxygen. This circumstance is just unbelievable that we would have people that are so greedy they would continue with these evictions when it's a no-fault eviction. This could be later. They could do this later in the year when there's less danger for these folks. I was wondering if the governor can give a moratorium against no-fault evictions at this time, at least until this crisis is over and it's safe for people to be out again.
Yes, this is Governor Inslee. Yes, yesterday we imposed a moratorium on evictions for failure to pay rent, and that is statewide. And for at least the foreseeable future, people should be safe from evictions based on failure to pay rent. The order also prohibited law enforcement from effectuating any unlawful detainers associated with failure to pay rent. Now, if there are other health-related issues, there still could be evictions. If there's a health and safety issue, that understandably there could be an eviction. But for economic reasons, for failure to pay rent, people should be safe from that at this time. So if anybody has a question about that, they can contact my office. And, this may not be a permanent situation, but right now we've got to protect these families. I want to mention something that all of us can help on, too. We are trying to extend the safety net to the extent humanly possible for all the thousands of Washingtonians who are temporarily going to be without work. And we have done several things to extend unemployment compensation, one of which is to remove the one-week waiting period that was previously in statute. But there is another thing that we need the president to do, which is to declare a federal disaster so that people who are what you might think of as part-time workers can get access to unemployment insurance. So right now you have to have 680 hours to qualify, but if there's a tornado or flood, that can go down to 0, so everyone can qualify. We are urging the president to act on this so we can get all workers qualifying for unemployment compensation. And we need either the president or Congress to help us on this.
Excellent. Thank you, Governor. If you're just joining us, you're listening to a TeleTown Hall on the coronavirus with Governor Jay Inslee, Secretary John Wiesman, and my name is Doug Shadel, AARP State Director. We're going to keep taking calls because there's a lot of people waiting in the queue here. Let's go to Ellen. Do you have a question?
Hello.
Ellen,
I have a question about deliveries and surface contamination. So that when we are getting deliveries at our home, is there a protocol for, in case the person in the truck is not well and is shedding the virus, how do we protect ourselves?
Great, Ellen. This is John Wiesman. Thank you for that question. We do know, that this virus can live on some surfaces for a bit of time. We don't know exactly how long that time is or not. And as you say, some people can shed this virus sometimes without even having symptoms. This is why we come back to those pieces that are so incredibly important. If you should get a delivery of groceries at home, the safest thing to do would be to, bring that in, unpack those groceries, and then wash your hands afterwards. And I think you can feel free to throw that bag away. So the washing your hands piece is incredibly important because if you do touch something with the virus, you're not going to be infected with it unless you get your virus into your mouth or your eyes or your nose. So that's where the good hand washing piece comes back in. And again, this isn't the primary way that this virus would spread. So it's really taking extra precaution by just safely, I think, unpacking your delivery.
Thank you very much for that answer. We're going to go to the phones again with Patrick. You're on the air. Do you have a question for the governor or?
Yes, I do. I want to know why the governor will not lock down the state, and if he really truly believes that these young people that were on Alki Beach and in Green Lake and all these parks around here are really going to listen to him and do the right thing.
Yeah, this is. Thanks for the question. It's something that we are every hour thinking about. We have not made any final decisions. We can do anything in the future, even though we haven't made this decision today. So we have not made a decision not to go further on social distancing. We just haven't affirmatively ordered this today. Now, all of us want to encourage all of our generations to act on this, including our young people. But I got to be honest with you, it's not the younger people who have the most ability to actually save lives right now. It's folks in my generation, because we have the capability, if we wrap a bubble around us, we're going to reduce fatalities by 90%. So if I had a choice between talking to somebody who's on the beach right now or a 70-year-old grandfather, and I could only talk to one, I'd talk to the grandfather, because those are the people that are going to represent 90% of the fatalities. And we have the ability to prevent this. I want to reiterate this. We have the ability to prevent this. We have the ability not to go to work. We have the ability not to have our grandkids over to infect us. We have the ability not to go to dinner with our friends. This is under our control. So, I'm as judgmental about younger generations as anyone, but I am on this call principally to encourage all of us to protect ourselves, because we have the most ability to do that. Now, we may be taking further action to reduce social distancing. As I've talked about, that is the most effective technique. We have had some success on that because we acted very early. We were one of the first states to ban public gatherings. We were one of the first states to close all of our schools. We were one of the first states to shut down all of the restaurants and bars and theaters, etc. So we have been quite aggressive very early. And as a result, we have had significant success. I'll give you an example of this. The proxy for judging our success, the best thing is our traffic patterns. That kind of tells you how many people are staying away from other people. In King County, we've reduced traffic by over 60%. But there are other places in the state where we have not. Spokane, we've only reduced it about 20%. On I-5 at Lakewood, 5 to 15%. So we have more work we have to do to encourage and eventually, if we have to, insist on people reducing their connections. There are a variety of ways to do that. All are open to us. And John and I and some of the best epidemiologists in the state, literally hourly, are monitoring our infection rates, our hospitalization rates, our traffic rates, our fatality rates, and we do very extensive modeling to look at this. But it's not just me who can help here. We've got about 14,000 people on the call, and those people can exert the most important thing, which is peer pressure. We can influence the people around us. We can influence our grandkids. We can influence our neighbors. We're all leaders here, so I hope people will continue to be a leader. So in summary, there may be further efforts coming when we believe the epidemiological evidence justifies the economic pain that people will feel being out of work if we have to take further measures. And that's what we will be thinking with on about an hourly basis.
Thank you, Governor. If you're just joining us, you're listening to an AARP TeleTown Hall, and that you just heard the voice of Governor Jay Inslee. We also have Secretary John Wiesman from the Department of Health, and soon we'll be joined by Attorney General Bob Ferguson. And if you'd like to join the conversation, press *3 on your telephone keypad now, and you can be connected to one of our staff people. Let's go back to the phones. Lillian from Linwood.
Yes.
Go ahead. Do you have a question?
Yes, I've been listening to all of it on TV, and I'm staying home as much as possible. And the only question I have, other than what's been covered, is what about our animals? Can the animals contact this? Is there anything on that, like cats or dogs?
Great, Lillian. This is John Wiesman. Thanks for that question. There's still a lot we don't fully know about this virus, but at this point, we don't have any evidence that animals or pets in the U.S. are carrying COVID-19. We are encouraging that if folks are ill, that they really do separate themselves from their pets, just for good general hygiene reasons. But at this point, we don't know of any. We do know that other coronaviruses can infect animals, like cattle and horses, and even sometimes dogs and cats. But at this point, we don't know of any right now.
Okay, thank you. We have a Facebook question. I believe this might be for the governor. It's from Tanya. Unemployment won't cover my bills. What do I do? there's a lot of questions in addressing that type of issue, Governor. I don't know if you want to address that or people are concerned about it.
Listen, this is Governor Inslee. I wish I could assure everyone that there will be zero economic troubles for our families. I wish I could do that. I cannot. What I can tell you is that we are going to exercise all the power we can to encourage the president, the Congress, the state legislators to do whatever we can to reduce the economic hardship of everyone who's going to feel this from a loss of work. As I've explained, we've done this by expanding access to unemployment compensation. The Congress is contemplating a variety of mechanisms to possibly supplement unemployment compensation. And we have encouraged employers, to the extent humanly possible, to continue compensation for their employees, which can be good business so that you can keep your employees to come back when this passes over us. So I will continue to seek every avenue to do that, but we at the moment have done what we can, which is to prevent evictions, to encourage employers to be compassionate with their employees, and encourage the Congress to seek other measures. As you know, there are some measures now under contemplation of the Congress to supplement loss of wages that are not covered by unemployment compensation. But I would also say this, and we're gonna have to pull together on a non-governmental basis as well, and as neighbors and as family members. And we are not helpless to help families in need right now. I know this seems like a small thing, but I've seen people in Spokane set up a supplemental assistance program for their neighbors. Walking around your neighbors and asking how maybe you can help throughout these troubled times may not be such a bad idea. Now, there are also programs that would help both, at least on a secondary effect, employees, which are small business administration loans, so that small businesses can stay in business. And obviously, we have so many small businesses that are stressed right now. So I'm hopeful that we get those dollars out the door on our small business loans as fast as we can.
Excellent. Thank you, Governor. Let's go to another call. Terry, you have a question?
Hi. First, I want to thank Governor Inslee and everyone who's been working so hard on trying to keep us safe and sound. So thank you. Governor Inslee, I know you're very familiar with our SHAG communities. And are you there? Am I here?
Yep, you're on. We can hear you.
This is Jay. I can hear you, yes.
Okay, thank you. So SHAG, of course, we love our communities. We're very fortunate to have them. All of our community rooms and libraries and computer rooms have all been locked, and we're all in favor of that. We're all practicing social distancing. And Governor, I think you're familiar that we all have terraces, and on our terraces there's a little place for our doggies to do their business. There's also a thing called pea patches. Are you familiar with those? And
yeah.
Yes. Okay. So the pea patches are where we have our tiny little gardens. And last night, Friday, at about 4:45, right before everybody dashed out the doors, the management that is, a notice was put on that we cannot go to our pea patches. And one of the things that happens to us seniors is we can get the blues, and not being able to go onto the terrace, it's, we have to get a bit of sunshine. If we practice our social distancing and we water our posy, I can't tell you how happy that makes me. Not being able to water my posy or pick a piece of lettuce for my salad, it's really a little devastating. I mean, I'm sorry to sound not sensitive to everything that's going on, but a little sunshine goes a long way. If you tell me that you think this is wise of shag management to keep us away from our pea patches, I'll try to grin and bear it, but really, what do you think about that?
Well, to start with, one of the things you said is very important, that access to sunshine and air and exercise is really important to all of us while we go through this time. And I'm hopeful that everyone can find a way to get outside and have a walk, as long as you're, distancing yourself from someone else. And I'm hoping everybody has that alternative. On the pea patch itself, what you might want to think about doing is talking to management and see if they could have something like a limitation of the number of people who are in the patch at any one time, so that you can have social distancing. And social distancing is basically you spread your arms out, and you got to be that length away from everyone at all times. So that might be a possibility. I would encourage you to talk to management that might work. There is a tension here, which all of us are going to have to work through, which is we want to reduce our exposure to other people, but we want to get fresh air and exercise. And I've got to believe there's a way to do both of those things by working together. So I hope that's successful. And I really value gardening, because when Trudy is in her garden, she's got the biggest smile in the state of Washington. So I recognize that, and I hope that works out. I think what we're all seeing here is that we are going to go through several days of trying to figure these things out together. And it'll be uncertain for a few days, and then I think we'll figure it out. And when we do, we're going to get through this. It's not going to be in the next week, but I'm confident we're going to figure out something so that you can get fresh air, and because we want you to have that. Good luck. Get those seeds in the ground.
Thank you, Governor Inslee. If you're just joining us, you just heard the voice of Governor Jay Inslee, and we're talking on an AARP TeleTown Hall about the coronavirus, what we can do to avoid it, and what government is doing to help us. My name is Doug Shadel, State Director for AARP Washington. If you'd like to ask a question of the Governor or Secretary Wiesman, press *3 on your telephone keypad now, and you can join the conversation. And in a few minutes, we will be joined by Attorney General Bob Ferguson, who will be talking about scams and how people are trying to rip us off. Let's go back to the phones. We've got Patricia from Tukwila.
Hello.
Yes, you're on. Do you have a question?
Yes, I do. We're hearing so much about how to take care of yourself and everything, and everybody is pretty much listening in my area, thank God. And my question is, what about who's taking care of the bills for this? I know this probably isn't the subject you want to get into, but if people don't have insurance and they don't know if they're sick or not, the hospitals are turning people away. I've noticed that some people go to urgent care, but if people don't have insurance, or low-income people can't afford insurance, even if it's the smallest insurance you can get, what do they do? Who pays for these people who might be sick? It's a big concern among a lot of people that I know. Could you answer that, please? Anyone?
Yeah, this is Jay Inslee. So number one, I'm glad that our state has expanded healthcare reform, so that we now, because of that, we have 800,000 more people who do have insurance. And I'm so glad that we've been successful in preventing the administration from taking that away. So that's one good thing. And for people who do have insurance, we have passed an order through the insurance commissioner that there will be no co-pays on this. So people with insurance won't have a cost to get the testing. The state of Washington, for those who do not have insurance, the state of Washington will pay for the testing process to determine whether or not you actually have COVID-19. For treatment for those who actually get the virus, we have Medicaid that is available for those who do not have insurance. And I encourage anyone should have access to emergency departments, which by law have to see people if they are in an extreme position. So I think that we've got a relatively good support network for those who are financially challenged through this, and we will continue to expand it if we find any holes. But I do want to put a plug in, and you know, this is a controversial subject, but I just have to say it. It is very disappointing to me that at this moment when we're having an epidemic, people back in Washington, D.C. are trying to take away insurance from 800,000 people in my state. I find that just morally bankrupt. So I'm really hopeful that that effort to take away insurance from my state fails. We can keep this insurance umbrella for 800,000 people plus. I hope we'll succeed in that. John, is there anything that you should add to that?
Governor, you did a great job. I would also just say that hospitals, as you say, can't turn away people for emergency care because of the inability to pay. And hospitals also have charity care and other ways to assure that people who need care, who can't afford it, get it. So everything you said is right on.
Thank you for that. Let's go to another caller now. Carol from Seattle.
Hello.
Yes. You have a question?
Yes, I do. I've noticed in all the information that's being provided by the CDC and locally that there is very little attention paid to mental health. This is a time of great anxiety and maybe even depression, and nobody's talking about it. So I wanted to get the word out that there are therapists available or just a listening ear, and they can go to the Washington State Society for Clinical Social Work. And there is a listing of members, and it gives their address, phone number, the areas that they specialize in. It's a very great resource. And they need to call their insurance company to find out whether that insurance company will cover telephone or online counseling, because many of us are all set up to do that, but we don't know if the insurance companies will cover it. So my main message is, please, if you're upset, anxious, depressed, please contact this website and find a therapist. There's lots of them on there, and including me.
All right. Thank you.
You're welcome.
Any comments about that, other folks, our guests? Mental health is an issue.
This is John Wiesman. Go ahead.
Go ahead,
Gov.
Go ahead, John. No, go ahead.
I fully agree with the caller's comments, and this is why sort of a number of things we're asking people do to try and reduce their stress from all of this. That's why I mentioned sort of turning off the TV if you're just constantly watching information about coronavirus. It can be very overwhelming, and finding other things to do with time, and why the governor and I certainly promote people getting out for a walk, again, safely doing that, as we've said, and being able to reach out for help. There's also the hotline for the Mental Health Services Administration here in Washington State, and that number is 1-800-985-5990. So that's 1-800-985-5990. And folks can also talk with folks by texting, I think, at 66746. So those are resources available as well. And I think, as the governor said, this is about us helping take care of each other and staying connected emotionally to people. So while we're creating our physical distance, we want people to connect with family via via telephone call, if you have FaceTime or Skype or any of those other ways to stay in touch, that's incredibly important. So thanks for your comments and that resource.
John, if I could add something, this goes back to one of the things I was saying at the beginning. I think we have 14,000 mental health assistants on this call right now, because all of us have the ability to help someone get through this period. And I just really encourage everyone to think of themselves in that context, because every connection we can make electronically now or at a distance more than 6 feet is really, really more important than maybe any time in our lives. So I hope everybody can pitch in.
Thank you, Governor. Thank you, Secretary Wiesman, for those answers. If you're just joining us, you're listening to an AARP TeleTown Hall on the coronavirus. And in a couple minutes, you'll be joined by Attorney General Bob Ferguson. And if any of you have received any kind of calls that you think are suspicious, pitching you on everything from my Social Security payments might be stopping and you got a call, or we can give you a free test, call us by pressing *3 on your telephone keypad now if you have a question for the Attorney General. He's the expert on sort of the scam aspect of this, and he will be joining us very shortly. We're going to take just a couple more questions, then I'm going to introduce the Attorney General. Let's go to Cheryl from Spokane.
Yes, this is Cheryl. My question is about the homeless. I'm just wondering, I live in the Shadel area, and most of the homeless eat like at the Subway and the McDonald's and places that are being closed down. And I'm just wondering what's being done for them. Are they?
This is Jay Inslee. So we are in the process of developing what you might think of COVID-safe homeless shelters. We are very concerned about our homeless shelters where people have to live in extreme closeness. And we want to develop new systems that get them further apart. We have been appropriated $200 million by the legislature, and significant part of those funds are going to give grants to cities and counties and nonprofits that are today developing additional COVID-safe sheltering systems. There are 2 or 3 under development in King County, at least 1 in Seattle or more. And we now are working with the Army Corps of Engineers, who can provide architectural services, to develop several more of these. We have a small facility in Rochester that the state of Washington also runs, that it can allow people who need isolation. It's a group of RVs, basically. So we have a significant appropriation from the legislature to build these facilities, some of which are old motels, some of which will be more pop-up facilities. We may need an additional appropriation from the legislature to really solve this problem, but I can tell you it is a very urgent issue because, as you know, once this virus gets into a confined community, it can be devilishly hard to deal with it. So it's all hands on deck. We're moving as fast as we possible to get people in safer sheltering situations.
Thank you, Governor Inslee. You're listening to an AARP TeleTown Hall on the coronavirus, and I'd like to switch gears a little bit. Now, Governor, are you able to stay on a couple more minutes, or do you have to take off?
Yeah. No, I've got more time. Thank you.
Thank you very much. I really appreciate the time you guys have taken. This is the busiest time I could possibly imagine for you, and it's just really, I really appreciate you taking the time. We have so many people in the queue still to have questions for you. But I'd like to introduce, is Attorney General Ferguson on the line? Bob, are you on the line?
Good morning, Doug. Yes, I hear you just fine. Hopefully you can hear me as well.
Yes, sir. Thank you for joining us. Well, we have Attorney General Bob Ferguson on the line, and General Ferguson has also been a frequent guest of ours on AARP Teletown Halls, and we have for many years teamed up to the fight against fraud and scams. And welcome, Bob. Thank you for joining us.
Okay, thanks for having me. It's always great to hear the Governor and Secretary Wiesman, and just really appreciate their fantastic work during this really challenging time.
Great. Well, we've talked in the past about, how scammers will use anything in the news to target our folks and everyone really. And I just wondered, you're on top of this. You have your finger on the pulse of what's going on there. If you could just describe some of the things you're seeing out there in the marketplace that we should be warned of.
Sure. Thanks, Doug. And AARP has been a great partner on these. And Doug, as you know and your team knows, and I suspect many of the folks on this call know, is that anytime we see a crisis of some kind, maybe there's a hurricane in another state and folks want to help out. Whenever you see some kind of crisis going on internationally, nationally, or here in Washington State, people want to help, which is obviously a good thing. But we also see, as you well know, Doug, lots of folks who want to take advantage of that instinct to help and really prey upon those instincts and adopt complex scams to get you to donate, for example, to a fictitious charity that really does nothing to help folks and only lines the pockets of those folks who are trying to scam you. We've definitely seen that in an abundance, unfortunately, with what's going on right now from a national health emergency. And just to give you an example, my wife showed me on her phone just the other day a text she received that said, hey, collect your $1,000 payment from the federal government. Click here. Obviously, there's been a lot of news out there about the federal government potentially sending payments to individuals of up to $1,000. Literally, she got that on her phone. She showed it to me. Clearly a scam, but this is the type of thing that I have no doubt lots of folks who are on this call either have received an email like that, a phone call, a text message, some kind of communication in varying forms that are really essentially scams. And that's why we really appreciate the chance to talk about this for a few minutes. And also, Doug, I hope to hear from your listeners, the folks who are on the call, rather, what they're seeing out there so we can get our arms around these different scams.
Yeah, thank you, Bob. If you're just joining us, you're listening to Attorney General Bob Ferguson, and we're talking about the scam aspects of the coronavirus. And if you have a question or if you've received one of these calls or emails about that, please let us know. We did get an email question, Bob, and I don't know if you've heard of this one. I just heard of it this morning, but apparently there are letters going out to older folks saying that because Social Security offices, local offices have been closed, your payment's going to stop if you don't contact Social Security. I don't know if you've heard of that one, if you want to comment about that. That is a very recent example of using coronavirus, I think, just as an out-and-out scam, but maybe you'd like to comment.
Absolutely. We have heard of that. If folks receive a letter like that, you can help us, just like you can help Secretary Wiesman, the governor, and the public health crisis by staying at home, right, which is hard for all of us. You can help us go after these scammers. If you receive a communication like that, to contact our office. I'll leave the phone number before we're done here, Doug, but to contact our office and let us know, because lots of folks right now are sending information to my team, whether it's price gouging, someone charging $50 for a small container of hand sanitizer. If you give that information to my team to send it on in, that helps my team follow up with investigations against those entities.
Yeah, why don't you give do you have the number with you?
I do. There's really two different numbers. I'll try and do it now, Doug, and then if you remind me at the end, I'll do it again because I know folks may not have a pen handy right now. But we have a 1-800 number, and that number is 1-800-551-4636. Again, 1-800-551-4636. We also just have a straightforward 206 number, Doug, and that number is 206-464-6684. 206-464-6684. And by the way, all these numbers are on our website, the Office Attorney General in Washington State, email addresses, phone numbers, you name it. We have a lot there, and my team is eager to hear from the folks on this call or anyone else about challenges they see.
If you're just joining us, you're listening to Attorney General Bob Ferguson, and we've been talking to Governor Jay Inslee and Secretary of Health John Wiesman about the coronavirus, all aspects of it. We've had a lot of calls on the line, almost 14,000 people on the phone now. And if you'd like to ask the Attorney General or the Governor any questions, press *3 on your telephone keypad now. Bob, you know that we have a partnership with a call blocking company called Nomo Robo, and they just told us about a call that is going out to thousands of homes. And this just shows you how quickly current events can be turned into a scam. It has to do with using the Family First Corona Response Act, which was just passed, I think, on Thursday. by the Congress and signed into law. And it says, because of this and because of the corona response, you can receive a free testing kit delivered overnight to your home by pressing 1 on your telephone keypad, and I'm sure if you press that 1, they're going to ask you for, information for shipping or whatever. But can you address that? That's probably not true.
Yeah.
Probably not true, right?
That's exactly right. And I'm glad you mentioned that because while it's hard to identify all the different scams that are out there, as you know, Doug, that is a good example of what we're hearing, along with things like, here's a cure for the virus. Here, as you said, you can get access to a test. If you see anything like that through the mail, through a phone call, through an email, through a text message, I just really encourage everybody who's on this call and to share this with your friends to be very, very suspicious of that. Do not open those links. Call someone like the AARP. Call my office. Call Secretary Wiesman's office if it's a health issue, right? There are folks who will help you identify whether or not that is accurate or not. And more often than not, these things are not true. There is no cure. There is no $1,000 check right now coming to you in the mail if you just click a link on your email. So to exercise extreme caution, which I know is challenging because, it's a stressful time right now, and that's what makes it so challenging for us.
You had put out a warning earlier last week just about these various scams. I wanted to focus on the charity piece for a minute. Could you just talk about what people should do because people are also very kind-hearted and they want to support legitimate causes. Maybe we could just go over the standard advice in that regard because there's a lot of, that's going to happen too, right? The scammers are going to come out asking for money.
Absolutely right. Doug, feel free to chime in. You guys are really the experts here, obviously, who work very closely with us. But it does bear repeating, as I mentioned before, hey, if there is a national disaster somewhere, people want to help out the victims of that tragedy. And charity scams are, possibly, Doug, I don't know what you think about this, but maybe the most prevalent that we see in a time like that. And it's certainly the same here with the virus situation. So a couple things. We don't want to discourage individuals from helping, obviously. That instinct is obviously critical. That helps us get together, get through a tough situation. What I would say is if you are not familiar with the organization who is requesting a donation, do not make that donation. Rely on organizations that you know well. But even there, you need to be careful because, Doug, as we've talked about in previous phone calls like this, sometimes there may be a well-respected, well-known charity that we all know, but a scammer will simply change one letter in the name of that organization. Change something, just tweak it a little bit, and suddenly you are making a donation to a scam, not to that actual organization. So the Secretary of State's office is a wonderful resource here, and you can check with them to see if someone is reputable or not. But to exercise extreme caution in making those donations, and Doug, I suspect you've got some additional thoughts on this as well.
No, I think that's exactly the right advice. And just as we've talked about for so many years, the scammers prey on people in heightened emotional states, and nothing heightens the emotion more than a pandemic. And we are all in a heightened sense of stress and urgency. And just to take a break, take a breath, these calls are going out throughout the United States, millions of calls now, just like we've experienced before, but they are all leading with the coronavirus, whether it's selling hand sanitizers and toilet paper. I wanted to ask you, Bob, about the whole thing about price gouging, and I think I had a relative who paid $65 for some 10 ounces of a hand sanitizer online the other day. What do we do about that? Is it illegal to do this? Is there a price gouging statute here? Is it under the Consumer Protection Act? Should people be reporting that to your office if it happens?
Sure. So, Doug, I think I identified 5 sub-questions there in your question. So I'll try and stick through them. So number one.
Feel free to take any of them in any order.
As a lawyer, you always have to watch out for the question that really has multiple questions. So, but in no particular order. So number one, is price gouging going on across the country and here in Washington State? Absolutely yes. Okay. Do we think that's illegal? Yes. Do I think it's immoral? I do. And so we have a significant team in my office who are taking a number of steps. We have sent out what are essentially subpoenas, Doug, to a number of online and bricks and mortar businesses. What that is, we send a subpoena saying, hey, we need certain information that you have about your pricing, in this case, on these products. And they are required to provide that information to my team. That's how we initiate virtually all consumer protection lawsuits, as you know, Doug. We have that power in my office to issue a subpoena to a business. So we do not identify the targets of our investigations. That's just a policy of ours. But look, the folks on this call have seen these and stories about entities, and those are the kinds of entities that we're focused on. So we have that going on. In addition, we have a team of investigators who have literally fanned out across the state into bricks and mortar stores where we have received complaints from consumers about the kind of price gouging you mentioned, Doug. So if we receive a complaint about a certain store, and we heard one in Chehalis where they were charging, I think it was $50 for a 4-pack of toilet paper, something crazy like that. We send investigators to that store to confirm if that's going on or not. So we have a team that does that. Now, we've had to be careful about that now, particularly in recent days, just with having folks putting themselves at risk by being out in public. But that's what we've been doing for some time now to follow up on all consumer complaints. So, yes, if a consumer complains to us and sends that information to us or calls in, we follow up on all of those. And so it's too soon to say now whether or when those will lead to lawsuits or not. But that is something we are very focused on right now. I think you also asked an interesting question, which is, do we have our own law on the books? And while I've got the governor here, I can preview a potential bill for next year, Doug. So I appreciate this with the governor on the line. So we actually do not have, unlike many states, we don't actually have a specific law forbidding price gouging. So in some states, for example, it says, once your governor announces an emergency, like Governor Inslee appropriately did here, at that point, the governor can identify certain products that it is now illegal to raise the prices on. Okay? We do not have a statute like that in Washington State, and frankly, we should. We do, however, have a Consumer Protection Act that you mentioned, which forbids unfair business practices. So it is my assertion that raising, in the case that you mentioned, the relative who had to pay $60 for a small container of hand sanitizer that should cost a few bucks, that increase, that price gouging, we would argue, is an unfair business practice. That said, it'd be far better to have a separate statute like other states have, and my team is already drafting such a statute to propose to the legislature next year.
That's interesting. So if we had such a statute, the governor could say, specify things like hand sanitizer, somehow designate them as something you for sure should not be raising the price on at a time like this?
That's exactly right. And then that makes it very straightforward for my office to enforce the price gouging law, right? It makes it straightforward for consumers to see if something's happened. If the price has gone up, you can't do that during the emergency. It's kind of a black and white issue. Other states do it a little bit differently. They say, for example, once a governor declares a state of emergency, you cannot raise your prices on products by more than, for example, 10%. Okay? They put a percentage on it. In our view, the case you mentioned, which we have heard from many others, hand sanitizer, 4 ounces, suddenly being $50 or $60. Look, that is clear price gouging. I don't care what kind of statute you've got. We think we can show that case. But we think a statute that is very specific around price gouging, frankly, makes it a little bit easier for us to enforce those laws. And also, I think it's good for businesses. Now they know what the rules are. It's very clear. These are the rules. Here's what you can do. Here's what you can't do. So we think it's better for everybody to have a very specific law like that. And that's why I'm going to propose a law like that next year to the state legislature.
Okay. Thank you. If you just joined us, you've been listening to Bob Ferguson, who's the Washington State Attorney General. We've been talking about scams related to the coronavirus. And we're getting close to our wrap-up time here. I think we want to go back to, thank you, Bob, for joining us with that very great conversation. I think we're going to go back and take a couple more calls, which is all we have time for, and then we'll give each of you the chance to wrap up, give some wrap-up comments. Let's go to Jim in Seattle. Jim, you're on the line.
Hi. Yes, I am. I'd like to ask whether the state can do anything to get more essential staples into the retail stores. Many seniors are worried that they see empty shelves in the stores, while toilet paper and water are not really critical to the COVID-19 virus. The hoarding and the scarcity are creating a lot of unnecessary anxiety, especially among the seniors.
Yeah, this is Jay Inslee. There's good news there. The supplies of groceries and basics are really in a stable situation right now. As you pointed out, the real problem of people who are doing these mass purchases that are straining the system that are really not necessary. So the risk is from the hoarding activity, of which we are all capable of stopping. And we don't want to have to go to some rationing system that really is not necessary here. So what I'd like to share with you is I am quite confident that the supply chain for civilian necessities of life is very stable. I'm actually confident it will continue to be stable throughout this. But if people go in and buy, 6 months worth of toilet paper, that puts a strain on the system, and that's why you're seeing some bare shelves right now. So the best thing I can say is to encourage everyone to just do your normal shopping. If we do that, we'll be in good shape, I believe, in that regard. Now, where the real strains are, as you know, are in the medical supply system with masks and the like. And we are just pedaling as fast as we can on that regard. We had some good news. Yesterday, we spoke to our federal partners, Assistant Secretary that handles these emergencies, and this weekend we will have 1,600,000 more N95 respirators. We will have 12 million more disposable glove sets and 560,000 more surgical masks that should come into our state tomorrow. So we're getting a good infusion in that regard, and we're being very aggressive building up our procurement system throughout that. We have also, and I just want to mention this because people may run into this, we've had to stop doing elective surgeries here for a while so that we can stockpile some of the equipment that would otherwise go to elective surgery that we can postpone for a while. So if anybody who's inconvenienced in that regard, we wish that was not the case, but we're going to get those going again, and we're going to move forward. By the way, I may have misquoted. My wife just pointed out we're getting 1.6 million N95 respirators, so that's going to help us a lot.
Wow, that's really good news. Thank you, Governor. We're going to take one more question and then give you each a chance to give some closing comments, kind of in the order we went today. Steve from Spokane.
Yes, hello, gentlemen. Are there any projections, even loose projections, of when this crisis might peak?
Great, Jim, or Steve, rather. Yeah, this is John Wiesman. So that's a really good question. And, what we've seen in other countries is that these outbreaks have been lasting maybe 3 months, 4 months time period. And so we're carefully watching this. We are trying to do everything we can to what we call sort of spread this out over some time and decrease the number of cases that we have. Our goal here really is to not overwhelm the healthcare system with a lot of severely ill folks. And it really comes back to why we had this call today and why the governor and I and the attorney general felt this was so important, because we all can have a role in actually slowing this epidemic and preventing the severe death that comes with that, especially with the people who are on this phone. Because if we simply stay home, stay away from others, we will stop the transmission, and especially for those who are most risk for the most severe consequences. So we all have to be leaders in this. We have to share the information that's been on this call today. We need you to use your moral authority with your friends and your families to make sure that they hear this message. And if we do that, if we can come together and do that, then we will slow this epidemic and we will prevent really deaths that don't need to happen. So it's going to take all of us to do this.
Thank you very much, Secretary Wiesman. We're coming to the end of our TeleTown Hall. I Really appreciate everybody being on the line. Governor Inslee, would you like to make a few closing comments? And before you do that, I just want to express our gratitude at AARP for your support of this effort to get the word out to our members. Any closing comments?
Yeah, just a couple things. First off, I really appreciate everybody being on this call. Look, we love our children and our grandchildren. You know, they're great generations. But the generations on this call are the wisest and most mature and most important right now. And everybody who's going to make a personal decision to wrap themselves in a bubble for the next several weeks, in my book, are going to be a hero. And that's going to be challenging, right? Because we love to wrestle on the floor with our grandkids. We love to hang with our friends and tell stories of past glories and future dreams. But when we defer those for a bit, we're going to do great things for ourselves and our families so that we can come out of here healthy. And so I appreciate everybody thinking about that. I want to do my little tiny part to help you through this. So I'm going to make a couple book suggestions to read while we're letting the rest of the world wait for us to come out of this. I'm going to recommend the book Kon-Tiki by Thor Heyerdahl. Kon-Tiki, fantastic adventure story of fellows going across the ocean in balsa rafts. I'm going to recommend West with the Night by Beryl Markham. Fantastic story of growing up in Africa. The first person to ever fly across the Atlantic east to west. And I'm going to recommend Profiles of Courage by John F. Kennedy. Fantastic story of leadership. And on the electronic side, I'm going to recommend my mother's favorite TV show, which was Golden Girls. And my wife actually watched this the other night and really enjoyed it. So those are my recommendations about how we're going to get through this. And I want to thank everybody's being a great Washingtonian for being leaders here. We're going to get through this together. We always do. Thanks a million.
Thank you, Governor, and thank you for those reading suggestions. That's everybody's spending a lot of time at home. That's relevant information also. Secretary Wiesman, would you like to give some wrap-up comments?
Yes, again, thanks for having us on this and for all the callers who have been on the line and so engaged. As we look about how you can help and how we get through this, just a couple of final things. First of all, I want to say soap and water is best. We've been talking about the hand sanitizers. That's important and fine when you don't have soap and water, and it works great. But folks don't need to go out and buy these bottles of hand sanitizer if you have access to soap and water. And it does not need to be antibacterial soap. Any good soap and water is going to do the job, and really encourage folks to be doing that. Secondly, if you are an eligible blood donor, blood donations are down, and that would be helpful if you're an eligible blood donor to consider giving blood at this point in time. And if you are a retired sort of health practitioner, we have an emergency volunteer health practitioner registration if you want to help with the effort. And some of this effort could be helping give advice to folks on telephone lines and helping in our healthcare sector. So you can go to the Department of Health website and to our coronavirus page to register for that. And the last thing that I'll say is I got my Census 2020 form yesterday. And so when you're sitting around home looking what to do, if you got that form in the mail, get online and put your information in there so that Washingtonians can count every single person we have living here so that we can get our fair share of the resources. So those would be my closing comments. Soap and water is great. Blood donation, register for an emergency volunteer health practitioner, and fill out that census form.
Excellent. Thank you. I'd second the census form. Well, all of your comments. Thank you very much. Attorney General Ferguson, would you like to say a few closing comments?
You bet. Thanks, Doug. And thanks for organizing this, Doug. We really appreciate it. And just a quick word about Governor Inslee's book reading list. He knows I have, my wife and I have young children. They just turned 12. They're twins, Jack and Katie. And every Christmas, they read a lot. Every Christmas, I give them like a classic book like a first edition of a classic older book. And so, Governor, last Christmas, I gave Jack Kon-Tiki, which he is loving. So it's a great recommendation, and I'm enjoying it too because I had never read it. All I want to add is just that, we just all recognize what a challenging time it is. Speaking as a parent, the kids are home from school. My wife is no longer working and no longer getting a paycheck at her day job. And that presents certain challenges for us on adjusting our schedules and our budgets and all the rest. I'm also mindful I've got a mother who's 91 who, we can't go visit her at her retirement home, which is the appropriate thing, but that also creates challenges for her. She's a very social person. She's in good health, but I just know it's a hard time for her. And I've given thought to the fact that her 92nd birthday is not far away. And, if the way things are going, there's not going to be a birthday party there with her grandkids and her kids, and we're from a big family. That would be, that'd be hard for everybody. So I just want to thank everybody for, echoing what the governor said, for, really banding together during this challenging time and doing the right thing and staying inside, as hard as that is on so many levels. I just want to thank everybody for doing that and doing their part. And again, Doug, thanks to you and AARP for pulling this event together. It's been great, and we look forward to hearing from people. If they have any issues on the consumer side, feel free to contact our office. Thanks, Doug.
Thank you, Bob. And I just want to thank our guests as we close here, Governor Jay Inslee, Secretary John Wiesman, and Attorney General Bob Ferguson, for their thoughtful comments and for taking a full hour and a half. I think this is the longest teletown hall we've ever had. It's certainly the most well-attended we've ever had, and it shows you the importance of this issue. And thank you to our AARP members, volunteers, and listeners all over the state, quite a few around the nation, as a matter of fact, on this call, for participating in the discussion. If your question was not addressed, please go to www.aarp.org/coronavirus, where we have a lot of resources about this topic. You'll find the latest information on what you can do to protect yourself and your loved ones. AARP Washington is a nonprofit, nonpartisan social impact organization. We have over 940,000 members, and we've been working for the health and well-being of older Americans for over 60 years. In the face of this crisis, AARP is providing information and resources to help you. And we've given out a lot of phone numbers on a lot of web pages today. If you didn't get a chance to write them all down, we're going to put them all in one place. And that is, I'm going to give you this one last website. It's www.aarp.org/WA. I'm going to read it again, www.aarp.org/WA. And we will hopefully have all of the resources we've mentioned on this call on that, as well as a full audio file of the call, so you can listen to it again. And we hope you learned something today new about the coronavirus that will help you and keep you and your loved ones healthy. Thank you for your attention, and have a great day. This concludes the call.